Hi guys, so Emily talked through the first part of this chapter and I will be picking up on page 375. As the medicine evolves and changes, each terminology must also evolve and be updated as things change. So next I'm going to talk about the terminology life cycle. In this life cycle there are three main phases: change request, terminology editing, and terminology publication. So in breaking these down, we need to define what this means. A terminology change request is a formal mechanism for users to submit requests for any changes or additions with respect to a given terminology. Terminology editing begins with the activation of a new concept, revision of an existing concept, or inactivation of a concept, and follows formal concept change and version management guidelines. When terminology editing is completed with subsequent documentation, a series of tasks is performed through the terminology publication phase to release a new version of terminology for public use. Basically, this is a big, long, drawn-out way to say that as medicine changes, the terminology systems must also change to keep updated. Next, we're still on page 375. We're going to talk about the International Organization for Standardization and their development of international terminology standards. The ISO said that each concept should be clearly identified with a unique identifier. Hence, there should be no redundancy, ambiguity, or vagueness. It also provides a framework for promoting terminology development and mapping, data analytics, and interoperability of nursing diagnosis and actions across healthcare settings. For nursing diagnosis, these components include the clinical course, clinical findings, degree, focus, judgment, potential, site, and anatomical structure, subject of information, and timing. An example of the nursing diagnosis, severe pain, which meets this standard as it consists of the clinical finding concept, which would be pain, and the degree concept, which would be severe. For nursing interventions, these must be composed of at least two categories of healthcare entities, including action, means, route, subject of record, and target. An example of this is the nursing intervention patient education about pain management. This comprises of two categories, which would be a nurse's education, which would mean it was the action, on pain management, which would also mean the target. Okay, so next we're going to go, still on page 375, we're going to discuss 10 healthcare terminologies appropriate for use in nursing recognized by the American Nurses Association. Of these 10 terminologies, 7 are specifically designed for nursing, and the other 3 are considered multidisciplinary. If you look at table 22.2, this is a good resource to break down all the standardized terminologies and whether they're used in nursing or multidisciplinary. The ANA also recognized 2 minimum data sets: the Nursing Minimum Data Set, also known as NMDS, as a framework for collecting nursing care data. And then there's the Nursing Management Minimum Data Set, which is also known as the NMMDS, as a framework for collecting nursing service data elements. To explain this, NMDS requires patient demographics, nursing process data, such as assignments, diagnosis, interventions, and outcomes, and service elements to assess quality of care. The NMMDS focuses on collecting variables associated with nursing environment, nurse resources, and financial resources to support administrative analysis and decision-making of nurse executives. The way I see it, the NMDS is more about improving overall patient care, while the NMMDS is more about the financial side and a way for the higher level executives to look at how care is being given. So for the remaining part of this video, I'm going to discuss the different terminology systems. We are now on page 376. First, we will discuss multidisciplinary terminologies, and these are all still seen in table 22.2. Multidisciplinary terminology is essential to communicate and document patient care data in alignment with the care process. Various types of data fall under this, such as lab results, medications, medical diagnosis and procedures, and billing information. So you can see why it's important to be able to document correctly with all of these different concepts coming together. So the first system we're going to talk about is called the Logical Observation Identifiers, Names, and Codes, or the LOINC, on page 376. This is a standardizing coding system for laboratory and clinical measurements. It's created using 6 axes: name of observation or analyte, property, substance concentration, mass, volume, the timing of the measurement, the type of system or sample, which can include serum, urine, patient, or family, the scale, which would be either qualitative or quantitative, and the method used to make observation, which is optional. All LOINC names are case sensitive, and if you look at table 22.3, this gives an example of blood glucose tests being coded using this system. This system contains more than 80,000 terms and is widely adopted. Nursing assessments can be structured in LOINC as a panel. So an example of this would be a skin assessment panel, which we see often in the hospital. This contains skin color, skin temperature, skin turgor, and skin moisture. So next we will talk about the systemized nomenclature of medicine clinical terms. So this would also be called SNOMEDCT. This is seen on page 377. It is the most comprehensive clinical terminology and has become an international standard for coding healthcare data. It is continually updated to meet users' needs, and it contains preferred terms and the related synonyms organized in a hierarchical tree structure with top-level concepts such as body structure, clinical finding, event, observable entity, procedure, specimen, and substance. Concepts lower in the hierarchy are more specific. In general, clinical questions for assessment and measurable outcomes can be coded using observable entity. Most nursing diagnosis and outcomes are found under clinical finding and event, and while nursing interventions and actions can be found under procedure. An example of the coding of this clinical question, ability to manage medication, with the answer unable to manage medication, is presented in table 22.3. So that's a good table to look at if you're still confused. Okay, next we will discuss classifications used for reimbursement on page 378. The International Classification of Diseases is used to report mortality and morbidity data worldwide and compare statistics. It is also used for billing, reimbursement, and allocation of health service resources for approximately 70% of the world health expenditures. Other healthcare providers may use a different coding system based on their specialty, so they may not all use the same system. But one example of this is the ABC coding system, which covers clinical services related to nursing, behavioral health, alternative medicine, ethnic and minority care, midwifery, and spiritual care. An ABC code consists of 5 characters representing the types of services, remedies, supplies, and practitioners. So next is the RX norm on page 378. RX norm is a normalized drug naming system derived from 14 drug terminologies containing drug names, ingredients, strength, and dose form. This system allows consistent communication among various hospitals and pharmacy systems. It also can be used as a knowledge resource to advance e-prescribing systems with decision support functionality to help providers make the right decision on prescribing the right medication for their patient. This is also a very important system because it helps prevent hospitals from double prescribing certain medications and also helps cut down on excessive opioid prescribing. So next we will discuss the World Health Organization family of international classifications on page 379. This is a classification system that focuses on functional status as a consequence of disease or health conditions. It is used mainly in physical therapy and rehabilitation professions, but can be useful for documenting nursing practice in acute care hospitals and early post-acute rehab settings. Concluding this video, I will begin to describe the nursing terminologies. Again, is seen in table 22.2. The ANA recognized 7 nursing terminologies or classifications supporting nursing practice. So 7 of these 10 are for the nursing, and the ones I just went over are for multidisciplinary. So I will begin with the critical care classifications seen on page 379. This is a classification system of nursing, diagnosis, and interventions organized under 21 care components to support documentation of the nursing process. This can be used for 4 different healthcare patterns of patient care: functional, health behavioral, physiological, and psychological. It contains 176 nursing diagnoses, from which 528 nursing outcomes can be derived using 3 modifiers: improved, stabilized, and deteriorated. As such, 201 nursing interventions can be expanded into 804 nursing actions. This allows users to express nursing care in any setting while maintaining a simple classification structure. Each component is assigned to a code with alphanumeric characters. So that's it for my section. I will go ahead and pass this on to Michelle for finishing up the chapter. Thank you for watching.